Agonizing and sometimes debilitating back pain can be experienced by people with contained herniated discs, an injury that strikes about 1.5 million Americans each year. Commonly referred to as a thrown-out back or pinched nerve, this injury can be accompanied by intense pain in and around the affected disc, as well as in surrounding areas of the lower back and in the legs. These discs, sandwiched between the spinal vertebra, are composed of two parts: a hard protective shell called the annulus, and a soft spongy tissue at the center, or nucleus. A healthy disc is like the shock absorber of an automobile, providing a cushion against jolts caused by simple movements like running or jumping. If the annular ring, or the protective shell of the disc, is damaged by injury or weakened by normal aging processes, a portion of the shell can give way to pressure from the spongy nucleus, causing a bulge outward. It is this unnatural bulge or herniation that often causes irritation to surrounding nerve roots in the spine, and the pain attacks that go with it. Decompressing the nucleus of the disc is a proven technique for relieving disc herniation and for treating the pain symptoms it causes. Disc nucleoplasty is a recent and significant leap forward in disc decompression therapy. Disc nucleoplasty uses a minimally invasive catheter to create an accurate 1 mm pathway into the disc. A micro-engineered alloy transmitter is introduced into the disc. Radio wave signals are sent through the transmitter into the jelly-like nucleus of the herniated disc. The radio waves produce a low-temperature ionized gas that breaks up molecular bonds in the spongy nucleus, dissolving tissue volume. When the injection procedure is complete, the transmitter is withdrawn. The removal of nucleus tissue relieves pressure on the disc shell, typically allowing the bulge to recede so that the disc no longer irritates the adjacent nerve. Normally, the entire procedure takes 20 to 30 minutes, and the patient is ready to walk out of the clinic in about an hour. Patients are awake throughout the procedure and require only a topical anesthetic and light sedation. Disc nucleoplasty is designed to offer a fast-acting option to drug therapies and steroid injections on the one hand, and a minimally invasive alternative to open surgery on the other. The patented action more closely resembles an ordinary steroid injection than a conventional surgical procedure. Disc nucleoplasty proven technology. Nucleoplasty disc decompression reduces the volume of the spongy nucleus within the herniated disc. The disc typically returns to a more natural shape, and the source of nerve root irritation is either minimized or eliminated.